Well, we all want to look our best, especially as we age, and there are ways to keep wrinkles and sagging skin at bay that don't involve surgery. Dr. Therese Stubbs from Therese Aesthetic Medicine joins me today to show us how. Hi, Dr. Ann, nice to see you.
Nice to see you too.
Well, we all want to keep looking lifted.
That's right.
You know, gravity, you can't fight it, but there are ways to fight back.
Gravity's not our friend.
No, gravity's not our friend. What techniques are we highlighting today that are non-surgical?
We're actually going to talk about some facial fillers. What happens to the face as all of us age is that we lose volume. So we see the cheek kind of sag down a little bit. We see folds here start to deepen. We see the corners of the mouth start to pull downward a little bit. And people complain a lot of times of jowling, or they feel like they're getting more tissue. And truly, you're not growing more tissue. You're losing volume right in here. You lose volume right in the tear trough area, and it gives people kind of a hollow around their eyes. And all these things are natural things that happen as all of us age. So we see them in just about everybody, maybe at different time periods due to your heredity, but it's a complaint of men and women alike.
And there are things that we can do about it, and I mentioned some folks are a little scary of surgery, so we have some before and afters. These are fillers. These go directly into the face. Usually.
Right. This is something that you inject with a very small needle into the dermis, which is the second layer of skin. And so you're basically putting it right under the skin, and it lifts your own tissue back up. So I like to say it kind of reflates the face. So right here we're looking at a gal. On the far left is her before picture, just kind of some sunken looking eyes. And you see on the far right we have some arrows. That's where we actually put the filler, right underneath the eyes. And so it lifts her cheek back up and gets rid of that dark circle under her eyes, gives her back kind of the ball of her cheek, and it lifts the face a little bit. She was complaining of looking tired.
Natural looking. That's the thing that struck me with all the pictures that you sent us, that while folks will look at you and go, oh, you look really good, they don't look at you and go,
what have you had done? Yeah. Well, I think that Hollywood has scared a lot of people away from fillers. But this young gal here, she said, the far left picture, she said, you know, everybody tells me I look tired. Just a little hollow under her eyes, a little hollow right in that fold by her nose there. And so we just put a little bit of filler in both those areas. And you see on the far right again where we put the arrows is where the filler went. And that picture was taken directly after her treatment, 15 minutes.
I was going to say that middle picture, that was right afterwards. Wow.
15 minutes afterwards. It's instant gratification, Gail. You don't have to wait for it to kick in. So this gal here on her top picture, she didn't like her thinning lips. She didn't like the corners of her mouth turning downward. She felt like everybody thought she was frowning all the time. So you see where the red arrows are. We put just a little in the border of her lips, and we didn't create Angelina Jolie there, but we did add some volume to just the border of her lip to get rid of those little vertical lines that women hate. Some people call them smoker's line or lipstick lines. And then we put some right in the corners of the mouth there, right along what we call the pre-jowl sulcus, just to kind of get rid of the downward turn to her mouth. And you can see the after picture on the bottom. The corners of her mouth are actually at a neutral position rather than downward turning. And it's very subtle, but it's a natural look, and it just got rid of the kind of pull down to the mouth that a lot of people don't like.
I noticed you mentioned the Angelina Jolie thing, and I think that's true, and that does scare people. Knowing that they can do it with a more subtle effect is very, very good
And I
news.
think probably Angelina's lips are probably natural, but some of the other folks in Hollywood that scare everybody, I think people are afraid of fillers in their lips, and it can be done very, very naturally. So this picture here, this gal did not like kind of what she called the jowling. That's the top picture, and you can see her chin almost looks like she just has a little dents there. And we layered some of the filler. The white arrows show we put it right along the mandible or along the jawline, and then we put some right at the corners of the mouth too, and we did the border of her lip too. So you can see in the lower picture she has just a little bit more lip volume, and once again very softly kind of straightening out her jawline, which directs the eye upward.
And then this is more of you did it at different places here.
Yes, this gal, she said to me, she was in her 70s, and she said, I am never going to have a facelift. I just want to look a little better for my age. And she'd just gone through the death of her husband and said, I've been mourning, and I'm going to get, I just want a little pick-me-up. So we put filler in her cheek area and right under the eye, and we put some right in that fold by the nose. We did her lip border, which she was most pleased with. She said she really just wanted to be able to put on lipstick again. And
okay, so as we're looking at all these, doctor, and how long will this last for these folks?
Usually lasts about 18 months. Sometimes people will come back in at about 6 or 8 months and get just a little, we layer just a little bit more on top. The studies have shown that within the first 2 weeks of the hyaluronic acid filler being in the skin, it builds your own collagen around it. So it really, even if you do it once and never do it again, I have that question a lot. Hey, if I do this once for my daughter's wedding or for some special event, am I going to be behind the 8 ball when it starts to wear off? And it's really something that helps your own collagen build. So even if it's only done once, it's something that's maintenance and building your own collagen around it.
Very cool, and the great pictures to demonstrate it. Dr. Ann, thanks. Nice to see you.
Good to see you, too. And I just wanted to invite you to and all your viewers to our holiday party on Thursday. We're having,
that's great.
Yes, our open house is this Thursday, and it's going to be 20% off on everything we do and everything, all skincare products. And if your viewers can't make it, if they just call in and mention your show, we'll still give them their 20% off.
Very good. Very good. Thanks, Dr. Ann.
Thanks for having me.